One thing I have been concerned about for several years now is the de-emphasis of the medical scientific case for trans acceptance and the damage this is doing. Certain activists have attempted to silence the case for trans acceptance based on the medical scientific understanding of gender dysphoria. This has led to the medical scientific case for trans acceptance not being heard much in the trans discourse. In contrast, anti-trans forces often use their limited understanding of science in their arguments. While their use of science is flawed, it often goes unchallenged because the other side is unwilling to talk in scientific terms at all. The medical scientific case for trans acceptance is simple. In clinical medicine, conditions are often diagnosed based on repeated observation of the same pattern in different patients, at different times and in different places. The validity of gender dysphoria as a medical condition is thus established because of it being repeatedly observed in thousands and thousands or perhaps millions of patients across at least the past 100 years and all over the world. This is actually a reliable method of establishing the validity of a condition, because things don't present in the same way randomly. Moreover, the establishment of gender dysphoria as a diagnosis means that doctors can attempt to treat it. The goal of treatment in medicine is to alleviate pain and to improve the quality of life. Ideological considerations like whether a certain kind of treatment conforms to social expectations are not relevant here, because they would distract from putting the patient first, which is what a doctor should be doing. Instead, a doctor simply practices medicine in an evidence-based way, and the evidence shows that medical transition is the only treatment that is effective for relieving gender dysphoria that meets the established diagnostic criteria. To withhold the treatment from the patients who would benefit from it would be unethical indeed. Those arguing that we can't prove the validity of trans identity and gender dysphoria because we don't know enough about the biomolecular pathways, for example DNA, genes, and proteins, that lead to gender dysphoria, simply don't know how medicine works. Doctors never start out knowing the biomolecular basis of a condition, and they certainly can't wait until the biomolecular basis is known before they start treating patients. If medicine functioned in this way, then doctors would need to refuse to treat a large number of conditions, because we still don't fully understand the biomolecular basis even today. However, to do so would be unethical, because to withhold treatment from patients who would benefit from it while the treatment is available and established to be effective would be unethical. Society certainly should not punish the patients for our own lack of knowledge. Gender dysphoria is no different from the other conditions that fall into this category here.